How do you stop teeth grinding, and should you get a mouth guard to protect your teeth? I want you to know the signs of grinding and how you can prevent irreversible damage to your teeth. And at the end of this video, we're going to talk about my personal recommendations for mouth guards. So what is teeth grinding? Teeth grinding, also called bruxism, is basically when you clench or scrape your teeth against each other. This can occur while awake or while sleeping. Some people are aware they're doing it, others are not. The problem with grinding during your sleep is that obviously you're asleep, so you're not aware you're doing it, and you're not aware of your bite strength. Most people clench or grind their teeth a little bit to some extent, but when you're doing this on a regular basis, doing it every day or every night, this is going to start to lead to some problems. Grinding while sleeping is also fairly common in children and young adolescents. Typically though, as they get older and their adult teeth come in, they typically stop this and grow out of it. Why do you grind your teeth? Many times it's due to emotions such as stress, anxiety, frustration. Many times people also use it as a habit or coping mechanism when they're concentrating. I personally used to have this problem when I was in dental school. When I was sitting in class, I would clench my jaw and I didn't even realize I was doing it until I started having pain. It can also be caused by missing teeth or an abnormal bite. So if your teeth don't come together easily, sometimes that can cause clenching or grinding as your jaw moves and tries to find a comfortable bite. Sleep apnea can also be a cause, as well as certain medications or lifestyle choices such as smoking, drinking certain drugs. It's also believed that caffeine can play a part. What are the signs of teeth grinding? If done regularly, teeth grinding can lead to a lot of problems. So in this cheek area, we have a lot of muscles that are used for chewing and opening and closing our mouth. If you're grinding your teeth all night and clenching, these muscles are going to be very sore. So when you wake up in the morning, you feel pain and stiffness in this jaw joint, we call it the TMJ, as well as the surrounding muscles. This is going to lead to difficulty chewing, difficulty opening, and sometimes locked jaw. Many times people also complain of having headaches and even sometimes earaches. Grinding can also cause a lot of problems with your teeth. So if you are continuously grinding your teeth, over time you are going to wear away the enamel of your teeth, and they will actually start to look yellow as you grind away that outer white part. This is going to lead to increased sensitivity as well as being more prone to cavities. I've seen patients grind their teeth all the way down to the nerve, and then they require root canals. Putting that much pressure on your teeth all the time can also lead to things such as bone loss, gum recession, cracked teeth, loose teeth, and sometimes eventual tooth loss. It's also going to lead to you breaking dental fillings and dental crowns, which then require replacement. In really severe cases, I've seen patients grind all their teeth down to little stubs basically, and they then require full mouth reconstruction with root canals and crowns, which is very expensive, or complete dentures. If ignored, teeth grinding can lead to a lot of serious side effects. How can you stop teeth grinding? First step is to try and eliminate the cause of your grinding, but it's not always easy to know what is causing it. Many times it's due to things such as stress. While I know it's not always possible or easy to eliminate the stress in your life, trying to find ways to deal with that stress can make a big difference. If you have a sleep disorder such as sleep apnea, then that needs to be treated. We aren't going to talk too much about sleep apnea in this video. That's a whole nother monster subject. But basically, sleep apnea is a condition in which your breathing stops and starts while asleep, and this can lead to a lot of serious health effects. If you have an occlusion issue, consider getting a consult to see if that can be corrected with ortho or possibly replace any missing teeth. Other things to try are to cut back on caffeine and alcohol. Try not to chew on pencils or chew gums, because this kind of gets your jaw muscles used to clenching. If you're aware that you're grinding during the day, then you need to start training yourself to stop. Another thing you can try too before going to bed is putting a warm washcloth on kind of your cheek area to help those muscles relax. Now, with all that being said, I know that many times teeth grinding is a habit that you can't really control or stop, especially while you are sleeping. So how can you protect your teeth with a mouth guard? Mouth guards, also commonly called night guards, are a great way to help protect your teeth from damage. A mouth guard is basically made from a mold of your teeth, so it then fits perfectly over your teeth and acts as a barrier. So when you're grinding at night, instead of knocking against your teeth, you basically slide over the mouth guard. It's also good for when you're clenching, it acts as a barrier so you don't put so much force on your teeth. There are different kinds of mouth guards. They can be made from either a soft material or a hard acrylic material. I typically recommend a hard acrylic mouth guard for my patients because one, the soft mouth guards typically don't last as long. Also, whenever you have soft material in your mouth, people tend to want to kind of chew and bite on it, which is exactly what we don't want. Mouth guards can also be made to either cover the top teeth or the bottom teeth. So you don't need one on the top and the bottom, you really just need one. Many times they are made to cover the top teeth just so it doesn't block the tongue and it's a little bit easier to get used to. However, in some patients with severe gagging or sleep apnea, a bottom mouth guard may be made. However, they both work the same and do the same job. I have patients ask me all the time about over-the-counter mouth guards and do they actually work? So there are different types of over-the-counter mouth guards. They can be either a one-size-fits-all or a boil and bite. A one-size-fits-all mouth guard is basically a pre-made mouth guard that is supposed to fit everyone. So it may or may not fit you. If you have really crooked teeth, there's a good chance that it's probably not going to fit you. If you are able to cover your teeth with it, it probably isn't going to be very snug though, and there will be some movement, and this can be kind of annoying while you're sleeping. With a boil and bite mouth guard, you basically heat it up in some hot water till it gets soft, and then you bite into it. This is going to create a little impression of your teeth. So with a boil and bite, it's going to fit a little bit better than a one-size-fits-all, but it still won't be as snug as a custom-made mouth guard. The over-the-counter mouth guards are also going to be more bulky than a custom-made one since it's not adjusted to fit your mouth. With a custom-made mouth guard from a dentist, we basically make a mold of your teeth and then make the mouth guard off of that so it's a perfect fit for you. The nice thing about a custom-made mouth guard is that it's going to be very snug, there's going to be no movement, and there's also going to be no overhang since it's going to be adjusted to fit you. I hope this video answered some of your questions about teeth grinding and mouth guards. If you guys have any more questions or comments, please leave them down below. Thank you so much for watching.